Virginia Medicaid does not consider obesity a chronic disease. And if you have asthma and you want to do remote monitoring in Virginia on the children, they have to have had 2 ER visits within the last 6 months in order for them to pay for the remote monitoring. So and to your point, I was going to ask you this question too. I only do per diems, but the practice I help is a solo pediatrician. She's been there for 25 years. And my idea is when I see a well child exam, if they have obesity or depression, that's why we're screening, we address the problem. So you put the 25 modifier and 99214 on the bill because it takes time. That's not part of the well child exam. She got a letter from Anthem Blue Cross Blue Shield that has over 40% of the business in the country saying, you're seeing too many 25 modifiers with your well visits. Stop it. So now I do what really irks me, which is I make sure that BMI is reported to United Healthcare and Anthem Blue Cross Blue Shield of Virginia can charge the state of Virginia more because these are more complicated patients. The child gets no care and the pediatrician goes and sucks in a lollipop. So it is just, it's, and then you're like, why do I even bother? Why do I even listen to Dr. Lander? I know that if they got depression, they screened in, I should cancel the kid and I should charge for that time. That's not part of the well child exam. But if I do, they're going to wrap my knuckles.
There were solutions. So disagree with you. So I was in private practice up until 3.5 years ago. I retired. And after 2 weeks, I went to my wife. Oh my God, I can't do this. I've got to work. So a friend of mine had 3 offices. And I said, do you want some part-time help? He said, great. So you Medicaid practice. So for me, we had very little Medicaid where I practiced before. Overwhelmingly, 90% of all the patients I'm seeing now are Medicaid. And my attitude is the same as yours. So someone comes in for a well visit and they're obese, I need to address it.
Right.
Doesn't take as much time though. And I have what I do with my own patients who are obese, what I want them to do and come back. ADHD. I had a 16-year-old girl last week, nice young lady. She's got a GPA of 3.1. We do the pH to look at her. And I'm seeing she can't concentrate. She feels bad about herself, et cetera, et cetera. So I started asking questions and yes, she can't concentrate. She's impulsive. She's forgetful. She can't stay on task. And I looked at the mother and I said, you know what? I really don't want to do the well visit today. This is very important. We need to discuss this and we'll reschedule you for your well visit, which the mom said yes. Because that's much more important to take care of than signing there at the form that they want. So come back in 2 weeks when I have an opening. But the other thing for what you said earlier, yeah, Medicaid is a pain. Absolutely a pain in the neck all over the country. A lot of the things that you said, you don't use the CPT codes for chronic care or care coordination. Time. You know that all of our CPT codes from the 99211 up to the 99205, there were times for each one of them. So if you have a kid who came in who is, you think, depressed, okay, and you did PHQ-9 in it or some other vehicle, and you're talking to them, and it's a known diagnosis, and they're coming back to you once a week, once a month. On those visits, bill it by time. Don't use the care coordination or the chronic care codes. You're going to get paid for that. Now, there might be RVUs in those other codes. Again, I don't remember how many RVUs there are for 99214, which is a 40-minute visit versus using something for chronic care, but you're going to get paid. So I might not get paid. I'll make up a number, $100 for that visit. I could pay $80. So am I losing a little bit? Yes, but still I'm doing what I need to do to help my patient because that's where I wanted to be. I'm happy, made a nice living as a pediatrician, but I love what I do and I love helping the kids. You're right, make a little bit less money. Some people try to make it up in volume, see more patients in the day, but then they're working harder. My consulting company, we say you want to work smarter, not hard. But if this is what's been happening but you're telling me in your own practice, start billing by time. And remember, it doesn't have to be contiguous. So if you looked at someone's records in the morning and then discuss something with them later in the day, the time adds up together. You'd be surprised